Members, we formed a quorum, and it's also our appointed time. May I call the meeting to order? The topic is medical health or mental health policy. The paper from the administration and also the background brief from the administration have been circulated to members before the meeting. And then on the 8th of February, Dr. KWOK Ka-ki sent a letter to the Health Services Panel asking for the setting up of a joint subcommittee on mental health services under this panel and also the one on welfare services with proposed terms of reference. We're going to deal with that before the end of this meeting. And then the Secretariat has also received a complaint referred to us by the Complaints Division for our follow-up. The administration has taken the initiative to meet deputations and individuals on this topic. So we have invited the deputations to come. I think it is a good thing because given that this is a new government and some legislators are also new, so it's a good idea to have a general discussion of this subject. Please invite the administration and the deputations to come in. We have invited members of the Welfare Services Panel to join our meeting as well. I just now saw Madam Chan Yun Han in the room. Oh, she is out of the room temporarily. I think she'll come back later. Welcome, Dr. KWOK Ka-ki, Secretary for Food and Health, and your team. And I'd like to welcome individuals and deputations for meeting with us this afternoon on the topic of mental health policy. I believe you have been to the council many times. Member of the panel asked for a special meeting to be convened, and once the secretary learned about this, he asked in particular that deputations be invited to here to air their views because Dr. Ko is new to office and there are also new legislators, so we would like to hear from you on this subject. So may I remind you that your speeches are not protected by the Electoral Power and Privileges Ordinance. In other words, your remarks and you have to be liable for your own remarks and written submissions. You will all have up to 3 minutes to speak each, and please be succinct as far as possible because we have quite a number of deputations here this afternoon. If you have not completed what you want to say, you can give us a supplementary paper afterwards. If need be, you can tune into channel 1 for floor, channel 2 for Cantonese, and channel 1, channel 0 is the floor, channel 1 Cantonese, and channel 2 English. Without further ado, I would like to invite Mr. Leung Man Hong, Executive Director of the Christian Oil Fellowship Limited, to start first. Chairman, Secretary, members of the panel, government officials, ex-mental patients, and family members, good afternoon. We are a voluntary fellowship running 17 self-help groups in different districts serving ex-mental health patients. I'm also a member of the Joint Conference to Promote Mental Health. I'm also a member of the Hong Kong Mental Health Council. According to WHO, there are over 100 million people who are depressed in the world. However, less than 25% of them have sought help. It's expected that by 2020, this will be the second most common disease in the world, only after heart diseases. So we face a growing population in terms of mental health patients. I'd like to ask whether the administration has taken into account this change and also our demographic change and come up with a long-term policy for mental health. If the government continues to use stopgap approach, and I think the following is going to happen again and again. For 5 years, the HA has got a 5-year mental health plan, and yet there is no similar plan for rehabilitation. This is very strange. And as for ICCW, well, 24 service centers are planned, but only 7 have got permanent premises. So the partner organizations are in plight. This is because the government uses only stopgap approach in tackling this problem. So I ask for comprehensive mental health policy and services so as to fill up the gap in services and the expected growth in demand. And as for evening clinic services, many service users have repeated their needs to the administration time again to no avail. According to the administration, they have done this and that survey saying that there is no such demand, and we are so frustrated and angry because how many people were aware of evening outpatient clinic services when they were still there, and how much effort was paid to publicize the event so as to enhance the utilization rate? Because there used to be a lot of very good services, but not well publicized. As a result, the patients and family members are not aware of them. For instance, clinics for injection after office hours, and also a special hotline for mental health patients. But patients and family members are not aware of them, so this is very worrying. I'm afraid that sooner or later these two services will be cut using the same excuse for cutting nighttime or evening outpatient clinic services. Thank you. Next, Mr. Philip Wong, Executive Member of the Alliance of Ex-Mentally Ill of Hong Kong. Good afternoon. I represent Alliance of Ex-Mentally Ill Patients of Hong Kong. We are made up of ex-mentally ill patients, and it's been 14 years since our establishment. We urge the HA to launch evening outpatient services. Although HA claims that there is a shortage of manpower, we do appreciate that, but this should not be at the expense of the rights of patients. I think there are ways to address this manpower shortage. HA can join partnership with the private sector so that after work ex-mental patients can go to designated private practitioners for follow-up at concessionary rate so as to lessen the burden on HA doctors and nurses so they don't have to work overtime. And secondly, regarding ICCM, we promised that we could attend services in other clinics in other districts, but many organizations are not aware of them, and I hope that there can be a cross-district quota for such services. And the psychiatric MSW is already overloaded. I hope the SWT can pay attention to this so that ICCMH can really help us to reintegrate into society. Many patient groups have to apply for funding from the administration once every 2 years, but the funding is limited, too little to support our operation. Do you know how much we get? We get $300,000 for 2 years. That is $150,000 per month, or $12,000 per month to cover staff expenses, insurance, and also miscellaneous charges. And a staff member has to be responsible for accounting our business of the affairs, so on and so forth. How can you expect to employ a competent person with just $12,000 per month? I hope that the SWT can apply a two-tier system. There should be a basic grant for those that are below 6 years of history, and then there should be extra funding for those that have been established for more than 6 years to enhance their support network. This will help save resources in the long term, and this will ensure that we can have proper planning and development of services for mentally ill patients, and that they can get the treatment they need.
Karis Wong, Mr. Stephen Wong, Social Work Supervisor. Mr. Ko, members, government representatives, good afternoon. I want to talk about the shortage of manpower in NGOs. This is a long-standing problem. I want to talk about several inadequacies which we have to face squarely. That is the lack of training staff. At present, we haven't been able to employ adequate auxiliary medical staff. Second is the inadequacy in structure. In ICCMW and other service organizations, we have just one OT2 and one nurse. But then they need professional training. But then their supervisors are usually the social workers. How can they provide professional support to these people? So this is a sort of inadequacy in the professional structure. Third is the inadequacy in the policy to retain talent. In NGOs, it is difficult for us to retain experienced staff. If they are able to find positions in hospitals, they would easily leave the NGOs and enter the HA system. How can we retain talent? Provide them with promotion opportunities. So this is something that the administration should think about. Next, I would also like to review the resources allocated to ICCMW. The center has been in operation for 2 years. The ICCM team, every ICCMW is established for 332,000 people, but then each district has their own characteristics. There is this district where more mentally ill patients are found, and then their cases are numerous. So how can the ICCMW maintain its normal operation, dealing with cases, doing public education and liaison work all at the same time? So it's time, after 2 years, that we should review the resource allocation. How can we support districts where there are more cases? For example, in North District, for my organization, every case manager has to handle over 100 cases. So in face of such heavy workload, how can we maintain good quality services? Now, the next question is about aging. Now, long care stay home has a big problem of aging in their residents, and over half of them are aged over 60, and then there is a lack of allied health staff. There are so many vacancies in OTs, PTs, and so on, and the service quality has been affected as a whole, and the residents' health are also affected. The CGAT team, which I've been striving for, has not been established yet, and also the environment is another issue. I think and I hope that the administration can tackle the problem of aging in long-stay care homes. The next one is Mr. Sam Leung of Hong Kong Chinese Civil Servants Association, Social Work Officer Grade Branch. I am a psychiatric social worker, and we are part of the Civil Servants Association. The first thing that I want to raise is that community-based rehabilitation is not feasible in Hong Kong, because Hong Kong is a very congested living environment. A lot of people are the grassroots people. When they are discharged from the hospital, or even they don't have a chance to get admitted to hospitals, they have to live in a very congested living environment. No matter how much manpower resources you are going to devote into it, the prevalence rate will remain high. There are many cases of mental patients committing suicide or involved in murder cases, and many of these are affected by noise nuisance, and they're triggered, the symptoms have been triggered by these causes. So I think the number of hospital beds should be increased, and the community-based rehabilitation service doesn't work. The hospital beds, the environment is very bad too. I often visit psychiatric hospitals, and the patients have to stay in the common room. They can't go back to their bedrooms, and they will chat, and they will wait to call telephones, and then they would just watch TV to kill time. So can the environment really be conducive to their rehabilitation? This is a big question. Now, a lot of mental patients would rather die than being admitted into a hospital. Third, about psychiatric social workers, a dozen more or so have been added because there were so many mental patients who have died. But if you have looked at the relevant report, our workload has not decreased. And a lot of our work is concentrated on administrative work like application, clerical duties, and so on. We've requested many times to the SWD for social work assistance to deal with social benefits for the grassroots so that we can do more home visits. But the SWD has rejected our request, and we don't know why. And our social workers are highly paid, and we're doing a lot of sort of downstream work, referral by doctors, and we have to find long care stay homes for for patients and so on. Also, there is inadequate places in halfway houses, and a patient should naturally be transferred to a halfway house. That's impossible, actually. Even if you are not particular about the district, you still have to wait for several months. Well, in the recent years, there have many new teams like ICT, PC, and so on. So many names, I don't even recall them. But then the psychiatric nurses have not been increased in number, and they are really not of much help to patients. Yes, we have received your written submission. The next one is from Baptist Oikwan Social Service Senior Service Coordinator, Ms. Chen Sao Kam. Mr. Cole, members, administration representatives, I'm speaking on behalf of Baptist Oikwan Social Service. We provide rehabilitation services for mental patients for 30 years and adolescents 10 years. In our services, we hope that the administration can strengthen rehabilitation mental health services for young persons, so that we hope that dedicated services on early intervention and early identification can be established, including special wards for young or mental patients. In Hong Kong Island, there is QMH, which has the designated young mental patients ward. If we have that special wards, then it can reduce stigmatization on them, and then we can also provide short stay services and help them reintegrate into the schools. Now, on prevention, we hope that the mental health education can be made part of the routine curriculum, so that the social workers at schools and young students can identify symptoms of mental illness at an early stage. I hope that the administration can also establish a cross-departmental program to draw up the relevant policy and devote more resources into it. Young people are an important stage in a person's life. Their needs are very different from adult patients. In advanced countries, the government has formed special departments to target the young mental patients. Now, on community services, there were earlier forums on the community treatment orders. And we hope that if a working group is to be established, the working group should comprise family members, ex-mental patients, and also other concerned groups, so that views from different sectors of the community can be canvassed and taken heed of. So I hope that the administration can conduct wide consultation on the subject and take heed of views from various strata of the society, so that the proposal can meet with ex-mental patients, their family members, and also the social service sector as a whole. Deputy Spokesperson of Health Services of DAB, Mr. Yip Manpan. Yip Manpan from DAB. We have all very been concerned about mental health policies and development of the services. In principle, we agree with WHO's proposal and to shift the focus of service from the inpatient services to community services, so that the ex-mental patients can reintegrate into the community as soon as possible. We think the emphasis should be on prevention, early detection, and treatment. We think that we should review the mental health policy as soon as possible. I have, together with Mr. Chen Han-pan, our DAB representative of LegCo, to visit the mental health associations, and many ex-mental patients are worried that if they have to take leave to consult the doctor during work, then they are worried that employers may not may object, and we all understand that regular medical consultation is very important to ex-mental patients, and if they are afraid of going to the doctor because of causing worries to the employers, and that would not be good. We hope the administration can set up evening clinics so that the ex-mental patients can visit the doctors in more flexible hours. The DAB has also received opinions from public doctors that the proposal of evening clinics should be supported. But we understand that doctors, or in particular psychiatric doctors, are inadequate in Hong Kong. In 2004 to 2005, there are 125,000 psychiatric patients, but then there are only 258 psychiatric doctors. So 1 to 500, that is the ratio. And 10 years down the road, 2001 to 2002, then the number of psychiatric doctors, 330. The number of psychiatric patients is 195,000, so 1 to 600 in the ratio, while the ratio has in fact increased by 100 in number. So I hope that the administration, when establishing the mental health review working group, can plan better for the patient to doctor ratio. We also hope that the the administration can review the drug list in the drug formulary to add in more drugs which have less disabling side effects, and also give subsidies to those who need to buy new drugs, so that the society can sort of recover, help the mental patients recover.
Next, Mr. Michael Mack from the Hong Kong College of Medical Health Nursing. Thank you. Good afternoon, and may I wish you every success in the new year. I'd like to comment on this topic from three perspectives. First, ensuring mental wellness, prevention of mental illness, and also treatment of mental illness. First, on treatment. Most acute and serious mental illness cases are being treated by the HA. Unfortunately, the quality of service are not in alignment with international practice. For instance, patients are still prescribed an older generation of psychiatric drugs. As a result, side effects such as stiffness, tremor, and drooling have greatly affected their dignity and caused them to subject to discrimination. And then hospitalization environment is also not very good. The Kwai Chung Hospital I used to know had only 40 patients in a ward, but now up to 50. So patients do not have sufficient room for them for emotional release. And the waiting time for the first appointment is so long. That's not helpful in controlling the symptoms at an earlier stage. As for nurses, there's been a long-term shortage of nurses. I'm also a psychiatric nurse, and we're all under extreme pressure. The Hong Kong PolyU provides 30 graduates, and the Hong Kong Open University provides 60 to 70 graduates per year. They cannot meet the demand from acute cases. It's now the 10th anniversary of the SARS attack, and back then we attached a lot of significance to the professionalism of doctors and nurses. I think this is food for thought for the Secretary. And as for maintaining and preventing, maintaining mental health and preventing mental illness, well, we have done very little to be proud of. We are a metropolis, and we face various stress and tensions at work, at home, and in school. And the government has no measures or plans to help people to handle their stress properly, and therefore increase the morbidity rate. According to my clinical observation, many patients chose to use drug abuse as a release from tension, and as a result, they went down a slippery slope. Well, I have this booklet here. Many of us are JPs. If you ever have the chance to visit mental health hospitals, please listen to the valuable comments of mental health patients and pay attention to the overcrowdedness of hospitals. I hope that we can have a comprehensive policy for mental health, and that we can have much more resources to maintain an environment that is conducive to mental health. Thank you. Dr. Frederick Ju from Hong Kong Equal Opportunities Commission. Thank you. We've already provided a written submission, and I just highlight a few salient points. First, the number of doctors, according to government's document, 330 odd psychiatrists. Before I came, I took a look at Medical Council's website. There are only 278 registered psychiatrists in Hong Kong. 1/3 of them are in private practice, 2/3 are in a hospital authority. That means less than 200 are actually serving in the public sector. One way to improve the situation is to train more talents. But who has to say as to the number of places to be provided in our medical school, in universities? I think there's something for the UGC to consider. And is it true that the population of the mentally ill is 195,000? As Mr. Mack said, it is important to ensure mental health. These 195,000 are people really mentally ill, but I think we should do more on prevention. And we do not have any figure on the overall situation. And then problem with the information. Of course, lives are precious, and we don't know how many people have took their lives as a result of psychiatric illness. According to the death of age is about 49%, but CU Hong Kong has just done a survey. They're saying that 87% of suicidal cases were related to mental illness. And I'd like to turn to prevention. There is a mental health month organized by the government or NGOs per year. Is that good enough? How much resources are we mobilizing in society to help prevention? For instance, have employers helped to alleviate the stress of the employees, and do we have family-friendly policies to ensure a good balance of life and work? Have students, have schools help students to deal with their emotions and to prevent drug abuse? Different sectors in society can help to do their part. I think the education sector, the healthcare sector, social welfare sector, and even the judiciary, and also the coroner's court can help to collect statistics for us. So we need high power and broad-based structure to help coordinate policies and to advise the government so that we can do a better job in terms of coordination. Thank you. Next. Mr. Michael Chow, Hong Kong Family Link Mental Health Advocacy Association. Thank you. Thank you, Chairman and legislators and Dr. Ko. Our association is a self-help group formed by family members of mental health patients. We're also a member of the Joint Conference to Promote Mental Health. We provide education program for family members of mental health patients so they can help their family members to get well and to be rehabilitated. Well, we've heard a number of questions, such as a shortage of social workers and also healthcare staff. However, family members of the mentally ill are often overlooked in their needs. I think they are even more frontline than medical and healthcare staff in helping the mentally ill on the way to recovery and rehabilitation. So every time we hope that the HA can include carers or family members of the mentally ill in providing support and help. You may hear that many organizations offer services to these family members as well, but from what you've heard, there is a lack of promotion. Even the patients or their families do not know how to have access to such services. Since the services are already there, well, allow me in saying that they are just tack-on services for carers and just ancillary to services for patients. It's true that we don't have enough social workers and professionals. It's not easy to have them trained overnight, but family members can fill in the gap. They may not be able to replace professionals, but they can assist and they assist patients and give them support during the process. And as for drugs, we hope that the government can use quality drugs, because side effects of drugs can be rather painful to patients. Some ex-patients feel that they don't have dignity because of such side effects, and they such side effects can also cause discrimination. And I'd like to talk about services. I think the administration sets more store by quantity than quality of community services. I hope that the government can pay more attention to the quality of services as well. Thank you. Next, Ms. Chen Shuying, spokesman from the Democratic Party. Thank you, Chairman. The DP, I would like to say this to the administration. It is honest in reviewing services for the mentally ill. I hope that it can really consider setting up a mental health council, because the structure, the government's organization may not be able to catch up with changes in time. I'm a Tuen Mun district councillor and have witnessed the changes in services for the mentally ill. Castle Peak Hospital was expanded in the last century, but after that, the number of beds were cut. Part of the Oz Hospital is now has now become a Siu Lam Hospital, or rather hostels for the severely disabled. So services are now more provided by the community or in the community than in hospitals. That means it's not just the HA or the MSW that are involved. If the Health and Food Bureau still takes the lead in providing services for the mentally ill, this is not sufficient. As mentioned by many speakers, many patients are really young people. If they are diagnosed as being mentally ill very early on in their life, they might have suspended their education or schooling. And after treatment, how can you help them to return to schools and continue their education? And what about their housing needs? If their housing needs are not resolved, you ask them to be discharged, you're just aggravating their conditions. They don't have the right supportive environment in the community. The neighbors may not be very sympathetic. So if they're just discharged into the community, that is a lose-lose situation for both themselves and also the community, and there may be conflicts as a result. While we support community-based rehabilitation services for the ex-mentally ill, I think in terms of policies and resource allocation, there must be proper coordination to address the problems. So the DP would like to reiterate its advocacy for the setting up of a mental health council to deal with the problem. Thank you. Mr. Chen KWOK Ka-ki from a group of supporters of the rehabilitated mental patients. Thank you. Also a member of the Joint Conference to promote mental health. Yes, a shortage of resources has been talked about so many times, and I'd like to focus on 3 points very close to our hearts. Ex-mental patients is not just about survival. We want to have a dignified life, a life with purpose and hope in the community, but the current services aren't helping us to achieve this goal. And I also like to talk about support to self-help groups. We are able to speak out here because of the support of a self-help group, but in between 2012 and 2014, only $90 million are allocated for 18 self-help groups. So on average, there are only $12,000 per month. New MSW will get about $14,000 a month, and the staff cost will be $360,000 per year. So the subsidy we get here can't even afford a social worker to help us. We are told that we are partners and advisory bodies to the MSW. In fact, we are not able to cope with the funding we get. And as for case managers, in other countries, case managers who will help ex-mental patients to deal with problems in housing, employment, and even in their emotions. Whereas in Hong Kong, a caseworker is just a position under the HA. It is not a member of the government. So how can it mobilize government resources such as housing and employment resources to help ex-mental patients? So please review the roles and functions of case managers. Thank you. Next. Mr. Johnny Lee from the Concord Mutual Aid Club Alliance.
Members, Chairman, good afternoon. Concord Mutual Aid Club Alliance is formed by ex-mental patients, and we are also a member of the Joint Conference on Mental Health. We think that private care homes are to fill the service gaps of in existing service gaps. But then the quality of private care homes is far below the standard, and they are not offering a dignified life for the mental patients. They don't provide rehabilitation services, and they are not free to move in and out of the care homes, and then they are charging fees unaffordable to the ordinary members of the community. And actually, a lot of them are paying the home fees through CSSA payment. After the fees have been deducted, we're left with, say, a few $100s only, and we can't do much with that amount. We are talking about helping ex-mental patients reintegrate into the community. But then we are allowing the private care homes to discriminate against us. So we have these suggestions. First, to come up with overall planning for various types of accommodation. And then second, to support those staying in the community. And also third, to take reference of elderly services to provide healthcare vouchers to them, and then also make regular inspections on residential care homes, and then asking these homes to report on incidents to the administration. And then the family members of the residents should have a mechanism to report or to complain to the home operators. Fourth, to provide more support to ICCMW and to set up ICCMW in every district to provide services. Thank you. The next one is Hoi Wai Chun, Alliance on Advocating Mental Health Policy. The Alliance is also a self-help group comprising members from family members of mental patients. We have spoken many times here at the LegCo, and our opinions are also put on our website. I think we have discussing the wrong topic today. We know that the administration will establish a review committee on mental health services. If we are just focusing on the mental health services, we will be back here again next year, because that's not sufficient, obviously. It's not that the HA and SWD is not putting efforts to tackle the problem. The crux of the matter is not just only about resources. Dr. Chu talked about psychiatric doctors. For a doctor or a specialty doctor, it takes over 10 years' time. So if you are putting your efforts in now, the fruits will only be seen in 10 years' time. Now, as case managers, not enough people recruited, and NCCMW is not adequately financed, and also we are not making proper planning. Now, if we're just improving service, we might say inject millions of dollars to enhance the services. But what is more important is the policy. What is our goal? Do we want to help ex-mental patients to integrate into the community? If that is the goal, then we just don't just we shouldn't just focus on services. Support policies for family members is important, and you have also to do something about accommodation as well. Now, if you depend on SWD and HA only, nothing much can be achieved. So also in the planning process are the voices of the stakeholders, like the ex-mental patients being heard. We've heard friends here saying that there is this community concern group made up of ex-mental patients. We have met with Mr. Ko. We have many suggestions, and we're ready to air our views. And it's really up to the government to take heed of our opinions. The Hong Kong and China has signed on the Convention on the Rights of Persons with Disabilities. So the community-based service is a major direction, definitely. But we have to do it to do a good job. Now, if mental patients are discharged from the hospital and they are kept at home, then it wouldn't help much in helping them to reintegrate into the community. I think more should be done. Next is Ms. Shirley Yong Sui Ling. Mr. Ko, Chairman, members and friends, good afternoon. Well, there are three elements to mental health policy. One is seeing the doctor, and then the second is taking the medicine, and the third is having an suitable place to stay. I would want to focus on medication. If there is good medicine, then we can recover. So I have 4 suggestions. First, I hope that the HA can use more new drugs. In the drug formulary, in the January of 2013, in that drug formulary, there are 21 types of drugs. General use drugs, 13 types, and then new drugs, 3 types. So 1/3 of the new drugs are not used on patients at all. So that triggers 2 problems. I think the use of new drugs, I think the HA can study on the effects of new drugs on patients, on how it can prevent the relapse of patients. Experienced doctors know how to make the right prescriptions. The administration frequency and the different mix of the drugs, and they will have different impact on patients. So, will the administration devote more resources in training up doctors and nurses on the use of drugs? We talk about knowledge management and knowledge sharing all the time. This is what I meant. If patients can talk about the conditions about experienced doctors, and the experienced doctors will be able to prescribe the right medicine to them. Third, will the administration ask the drug companies to provide their usage and catalog in both English and Chinese to enhance the knowledge of the drugs? A lot of the drugs come without Chinese description, so that's not good. Lastly, can we enhance the dispensary or pharmacy services? Because the impact of the drugs on the patients may differ from one patient to another, and public patient education is important. If, say, a certain patient has to take psychiatric drugs at the same time with drugs for diabetes and high blood pressure and so on, then if the pharmacist can be trained to educate the patients, then that would be best. Thank you. The next one is Ms. Pang Ching Nam, People with Mental Illness Rights Concern Group. Good afternoon. I am an ex-mental patient. I want to share my own experience. I have once joined the workforce, but I didn't say that I was an ex-mental patient. I earned over $10,000 a month. But later on, through the Job Employment Assistance Service, they told me that they have jobs of paying just for $1,000. So I think I was being discriminated against. And then I got this other colleague who disclosed that she was really an ex-mental patient and was dismissed very soon after she made that disclosure. So can the administration require employers to employ a certain ratio of ex-mental patients as their employees or give them some subsidies? I think the discrimination problem is serious. Oh, that's all I want to say. The next one is so-called Society for Community Organization, Mr. Tim Pang. We've been concerned about patient rights, and we are also part of the member of the Joint Conference on Mental Health. I'm very happy today that Mr. Ko is here at the meeting. As far as I recall, since 2003, when the mental health topic was discussed in the LegCo, never once has a secretary been here to meet with us. So I hope that Mr. Ko can elevate the subject to a really high policy level. So after reading through the administration's paper, I'm a little bit worried because the administration keeps on saying there are new services and the number of places offered and so on and so forth. So if you focus purely on the services, what they can achieve, then you are missing the whole picture. If you want to tackle the whole the services, the crux is on whether you have a comprehensive planning and whether you have a comprehensive policy, a clear direction goal, so that the entire government and all the subsidized parties can move ahead towards the direction. One example that I want to cite is that there is an example in the information in the appendix of the background of the paper of the background brief. And this report shows that the administration has allocated more funding to HA in the past few years. But then patients are not satisfied entirely. There is still much room for improvement. We've talked to the HA, and we got the impression that the HA wanted very much to provide good services. But then there are areas which are beyond their control, like manpower planning, resource mobilization, and so on. This is something beyond their control. If we want to provide good services, we have to have high-level planning. Now, another question relates to resources. The expenditure on mental health is only 1.6% of the entire government budget, and that compares unfavorably to 2.8% of overseas countries. Every person in Hong Kong gets like $570 in mental health service, compared to UK and Australia. It's like they are having a figure of $1,900, and that ours takes up around 1/3 of their expenditure. I also want to point out that I have two suggestions. One is the review committee on the mental health. On the terms of reference, I don't think they should just be focusing on review of the services. They should be looking at policies and see whether there are statutory council to be established. I am happy that the patients' representatives are represented on the review committee, but other concerned groups like statutory bodies like EOC, can they be represented on the review working group as well? So I hope the administration can respond to my suggestions. The next one is Fong Chung Team, Director, Richmond Fellowship of Hong Kong. Thank you, Chairman. Secretary, good afternoon. We are very concerned about whether there is adequate support policy. From our experience, we want to raise a few suggestions. I think mental health doesn't have to do only with medical policies because it encompasses a wide service areas. In opening new services, NGOs or service organizations face difficulties of a lack of venue and inadequate professional staff. It shows that the government has not been properly planning for these services. 8. ICCMWs don't have permanent premises. And even if they do have a premise, they meet objection from local residents. Even if they have the funding, they are not able to roll out their services smoothly. So the problem that we're facing should be tackled and coordinated at a more senior government level. And also district council should help us in convincing the public to accept us. The service sector is generally of the view that we can take reference from the Elderly Commission and Women's Commission, and through establishing a mental health commission or council to map out mental health policies. As mental health issue involves a wider spectrum, say the community treatment order involves the interests of different stakeholders. So their views should be fully taken into account of. So the relevant committee should comprise representatives from ex-mental patients, their carers, and the care workers and medical staff and so on. Well, it is an undisputed fact that it is more effective to provide community-based services rather than inpatient services. There are some special circumstances. Elderly patients need more care, and also young people who are on drug abuse need special care needs. So the present services might not be able to do enough on preventive work. Our service provides 24-hour support services. We can only get funding from the community, and we haven't been able to get any funding from the government at all. So I think the government should do more preventive work. Public education. I think public education should be sustained. There should be sustained efforts on public education. When there is so much misunderstanding in the community on mental patients, we should continue and do public education on a consistent basis, continuous basis.
Next, Ms. Zhong Xiuhua from Amity Mutual Support Society. Good afternoon, Chairman and members of the Council. Ex-mental patients rarely have the opportunity to express our views and to take part in policy formulation. So under many circumstances, the administration may feel that, well, we have already planned and provided things, services and medicine for you, and we're never consulted. Let me quote a simple example. We hope that the police can improve their practice. For instance, a couple quarreled at home and their children called the police, and policemen came with their shields to try to calm down the couple, and then the woman calmed down. Subsequently, however, she was sent to hospital against her wish. However, the police paid no attention to her wish. And then after discharge, the lady quarreled with her husband again, asking why he insisted that she should be hospitalized. So can they be regarded as just an ordinary couples? So must they be sent to the hospital? And what ways do we have to communicate our views to the relevant authorities? There is no such channel. And we have considered the paper from the administration, and there is a there's interdepartmental working group with representatives from the police, the SWD, the housing department, the HA, so and so forth. It reviews its work once every half a year. We hope that ex-mental patients can be included as a member. Well, we put that request to the administration last year, but we have yet to hear from the administration. Since the government is new, I hope that they can pay attention to our needs. Well, in each district, there is this working group, and we want ex-mental patients to be represented so that when we have comments on community support or on our needs, we can voice it out at the meeting. So we really hope that our views can be heeded by the relevant authorities. Thank you. Next, Mr. Ho Ka-chun from New Life Psychiatric Rehabilitation Center. Thank you, Chairman and members. Good afternoon. We represent the New Life Psychiatric Rehabilitation Association. We're committed to promoting the mental well-being of ex-mental patients and their family members. And we also hope that ex-mental patients can be included in society on equal footing. Well, we have a few comments to make. First, we are concerned about the service gaps for the mentally ill. Well, we have served, we have set up ICCMWs for 3.5 years, and we can feel the specific needs of specific groups regarding resource and support from the MSW. There are inadequacies. For instance, people suffering from mental health problems because of drug abuse, and also demented patients. For people who are suffering from mental illness because of drug abuse, well, the crisis index is usually higher for this group, and yet the awareness to seek help is also lower. And we're dealing with adult outreaching problems. For a simple drug abuse case, no psychiatrists or psychiatric nurses will be deployed to approach these cases for assessment. And the unit will only require such cases to go to their centers personally for assessment. And therefore, our frontline staff of ICCMWs do not have enough support, and they have to spend a lot of time to assess these very risky cases. And as for problems of the elderly, as our population grows older, we don't have long-term planning for demented elderly. So when demented elders have psychiatric symptoms, the community would expect ICCMW to provide comprehensive assessment and follow-up, adding to the pressure of such centers. So we suggest that the administration have dedicated services for specific groups of mental health patients, or manpower be provided to ICCMWs to follow up, and then outreaching services of the HA should be enhanced to provide outreaching follow-up and assessment of specific groups of mental health patients. We're also concerned about the psychiatric, the mental stress faced by people living in inadequate housing conditions. The government should review its control of subdivided units and expedite the allocation of PRH to ex-mental patients. Thank you. I give the floor to Dr. Ko to walk us through the government's paper, and then members can ask questions. Thank you. Chairman, I agree with you that my task should not be as simple as just to introduce the paper to members, because I believe many members have already read the paper. I think I should try to respond to some of the comments raised this afternoon. Of course, the government attaches great importance to the mental well-being of the public, and also to the treatment of mental illnesses. So many deputations talked about prevention and publicity. Well, I would disagree if you say that we don't attach significance to this area. I have worked in different units of our public healthcare sector. I must say that we attach a lot of significance to promotion of mental health. While I once have left the hospital authority for a while, I think what we have done have gradually reduced the stigmatization of ex-mental patients. Has it been 100%? Well, I think it takes time for discrimination to go away. Well, I dare not say that there is zero discrimination here. I'd like to say that in many ways, stigmatization has improved. This is because the administration has done a lot to promote and educate the public on the question of mental health. However, I do agree that we should sustain our efforts and also do more. Rehabilitation. I think most speakers agree that community-based treatment should be emphasized. However, some representatives from frontline workers are not entirely in agreement. I won't say that I disagree with them entirely, because Hong Kong is very different from other jurisdictions in many places. For instance, we are more crowded, and we are highly urbanized, and life is more stressful here. And there are also deep-seated conflicts in society. I agree that these are the factors, but I don't think that these factors should ask us to turn back on the direction of having community-based treatment. I agree that we should review our effectiveness and provide more resources to support community-based treatment. But what I disagree is that we should discard our policy of community-based rehabilitation. According to many deputations, from profession to treatment to community-based rehabilitation are provided by different organizations, including the HA, the MSW, NGOs, as well as the housing department and also the police. This is very true, but we should face up to this reality. Well, we should not say that because of this we should form an other bureau or council to tackle the problem. Now, if the Health and Food Bureau is not doing a good job, you think another bureau can replace us, and well, I would accept it if it's just a warning for us to make it to be more vigilant. But if the bureau doesn't take the lead, then which bureau should be responsible? Of course, there must be interface with other departments in the community, the police, for instance. But this is a health problem, a health issue. I feel that I have an unshakable responsibility to take the lead in carrying out the review. I being the Secretary for Food and Health, unless you believe that I am incompetent. I think the government has been kept reviewing the our mental health services, and in this area there have been various improvements in the past. Whether they are sufficient is another issue. For instance, psychiatric drugs. Well, I have heard this even before I left the HA, and I've continued to hear complaints about this. But from an objective point of view, from statistics by the HA, over 60% of the psychiatric patients are being prescribed new medicine. Is there any room for improvement? Certainly. But I think this is already a great difference from what I heard in the past. Should all patients be prescribed new medicine? Well, I think there are both pros and cons for using old and new drugs. I have the feeling that deputations feel that only new drugs are effective and they are excellent, and old drugs are very backward and useless. The trend is more and more new drugs have lesser side effects, but if you say that old drugs are entirely useless, well, we have psychiatrists here. I think they can elaborate from their professional perspective. I think the HA has been more lenient or relaxed in prescribing new drugs. Can we ask our frontline psychiatrists to be not so restrained? Well,
they would prescribe it based on their professional judgment and taking a balanced consideration of all sides. And then they can still use old drugs if they think they are fit for that particular patient. On the community-based rehabilitation services, the case management program, it is not in full gear yet, but we have the HA plans to extend it to all districts in 2 years' time. Well, these services may still be insufficient by then, but please appreciate that this is the right direction for us. And if resources permit, we will further expand the services so that the workload on each case manager can be reduced. So much for my response. I would also like to talk about this, unless the panel disapproves. We plan to set up a committee to review the existing mental health service provision with a view to promoting mental health and strengthening support for persons with mental problems. We suggest that the review committee will be led by the Food and Health Bureau and do a coordinating work. I heard views that patient groups and NGOs should be represented on the review committee. Now, if the review committee comprises over 20 members, like what we're having today, then that's not very ideal. And we would think instead about how to establish channels to listen or collect your views about mental health policy. I heard many saying that we lack a mental health policy. I agree that in the review we would also consider the mental health policy. Is it true that we don't have a policy? No. The administration does have a set of policies. But for various reasons, like your views are not represented, or this particular sentence was not included in the policy, you think we don't have a policy. We would be looking at mapping out a policy. A policy may be just in one sentence or in one paragraph. It will be impossible for us to include everything you said in our policy. So before the policy is mapped out, we would be considering how to collect your views. And whatever policy we come up with, it may not include everything you say today. So I have to make this clear first. After the review, we would definitely be coming up with a policy. The policy would definitely include promotion of mental health, treatment of mental illness, and rehabilitation services. These three aspects will be included. A deputation also said that the community knows that we are considering whether to introduce a community treatment order. But as what the deputation representative said, the CTO involves interest of different stakeholders. So it's not something that is easy to implement. We have to balance the views given to us, and also we have to take into account the legal consideration, because this is, after all, a legal tool. We are now preparing for the establishment of the committee, and our aim is to hold the first meeting in the second quarter of this year. This is not going to be an easy task. My preliminary thinking is that the review would take at least 1 year. While you may have different views, some may think it's too long, some others too short. But for a complicated subject like this, after in particular hearing your views, I think the 1 year time frame is a suitable one. The medical and social welfare sectors are involved in this review. So the representatives from HA and the social welfare sector will be included in the committee. We have to strike a balance in the membership. Taking into consideration, we will include HA representatives, representatives from the social welfare sector, and so on. As far as EOC is concerned, I think it is an appropriate party to be represented on the review committee. But of course, we have to consult the EOC whether it wants to get involved in this review committee or whether it wants to maintain a rather independent status. But personally, I think EOC's views should be respected. Yes, so much for my response. Thank you, Secretary. Then it's now the floor is for members. Dr Hon KWOK Ka-ki, Chen Han-pen. Elizabeth Quat, Alice Mack, Mr. Vincent Fang, Chen Ting-bo, and Wu Chi-wei. A total of 11 members. We still have 40 minutes left, so 11 members, perhaps 3 minutes for each. Well, perhaps we can extend the meeting time a little bit. Do you have to attend the meeting on the Welfare Services panel at 4:30? Yes, Mr. KWOK Dr. KWOK Ka-ki said you suggested that we would establish a special working group to follow up on this. Well, 3 minutes each from a member, including Q&A. Dr. Fernando Zhang first. We've been following up on this for 7 to 8 years. 3 minutes is definitely not enough. First of all, I would like to thank the deputations to give us their views. The points made have been made, in fact, over many years. But I think it's good that you insist and maintain your on following up on the matter. We have the new secretary, and I think Dr. Ko, compared to the last secretary, is a better secretary. Well, that's only my personal view. And he is more specific, and he undertook to set up a review committee to look at the mental health services. I don't agree with just reviewing the service. Dr. Ko talked about a policy maybe in one paragraph, but as far as I understand, the policy may include your concepts, principles, and your directions and universal values, but you have to have the specifics. You have to look at what problems are there at present and how to take forward the principles and implement them in our existing services. So we've raised so many suggestions over the years. A friend, a deputation, also talked about planning, manpower, and land planning. And you should take an overall perspective on things. Because of the segregation of medical and social welfare sectors in our present state of things, I think Dr. Ko, you should take a review not only of the services but the policy as well. You should also establish mechanisms to gauge the views of the concerned parties. The concerned parties include the service users, the family members of ex-mental patients. You said here that you have representatives from patients' groups. I hope that you would really do that. Well, in the last term of government, it also talked about setting up a review committee. I don't know what the review committee had discussed previously. And actually, apart from Dr. Ko, many of the government officials in the last review committee are still here. So can you tell us what you have been doing in the past? First, I would like to clarify that I said that that the review should not only be on services. I think it should cover everything from treatment and to rehabilitation and so on. So everything would be included in the review. So I'm rather ambitious. I want to look at every aspect of that portfolio. Now, as for what the last term of government has done, what they did is really a starting point for us here. I have to review what they have done, and then it would be quite impossible for our colleagues to not of much meaning to tell you in elaborate terms what the last term of government has done. I would not be starting, say, from scratch, but rather I will look at what has been done in the past. I also stress that it's not that we have done nothing in the past few years. There have been improvement made in certain areas. So, well, in all, I agree with what you said, okay? Dr. KWOK Ka-ki, the first thing is I want to thank the deputations for coming here. In 2004, the secretary may know, I tabled a motion debate at Legislative for an overall review of the mental health policies, and the last secretary set up a working group. And before any oral question was tabled in the Legislative, he would be convening a meeting. So he would be holding a meeting once 12 to 18 months. Of course, I hope that you will do a better job than your predecessor. I agree that there should be a policy. Well, there is actually, in fact, a policy in EU and in many European countries, in Singapore, and mental health. It spells out clearly on community-based services and treatment approaches and so on. The mental patients are having a consultation lasting 4 to 5 minutes, and around 30 to 40% are not on new drugs, and because they can't afford them. So I don't think the Secretary has knowledge of all these. Even if you are a very capable person, you have your portfolio so wide, including baby milk formula and columbariums and so on. So apart from a good secretary, we also need a good structure. So in our previous discussions, we talked about establishing a mental health council. That is not going to have conflict with your bureau. The council really is to provide a platform for different stakeholders, including patients and family members, to work together. I am very happy to see many ex-mental patients here, but they are in the minority only. We have around 20,000 ex-mental patients. If we can give them genuine help, a lot more vitality will be injected into the community. It's not a waste of resources at all for offering them assistance. If one ex-mental patient has not been rehabilitated well, the whole family will be plunged into a plight. Of course, we will have a working group to follow up on the issue. Can the administration, the secretary, promise to on a timetable on the review?
Well, as said by the two members who have just spoken, we must have a policy direction for a review. Of course, we cannot just have a direction. So I agree with Dr. Zhang. We have to review all aspects of services being provided and come up with objectives before we can call ourselves complete in the review. So 1 year is cutting a bit fine, but I think at least at some stage we will present a comprehensive policy. And to digress a bit, I think that's a point mentioned by one or two representatives here this afternoon. In the area of mental health, there is also the question of needs of the elderly and also demented elders. Well, some may disagree that this is entirely a mental health problem. Well, I dare not say that we will cover all the aspects of demented elders, but we have to include that. Secretary, I think you should respond to Dr. KWOK Ka-ki's question now. Dr. Hon KWOK. Thank you. I must thank the 20 deputations who told us their views this afternoon. In the past few years, I think we have met to discuss various issues, and I think this afternoon we have a good conclusion, a summary of views. And then I think we are a little bit assured by what the Secretary said in the past few minutes. I think the steering committee has already accomplished, has already seen its term ended, because there is a review committee set up, and we are going to chase the review committee in the future. Secretary, it is important that services are reviewed, but very often the attitude or the mentality of the public might have defeated the purposes of our services. So 1 year is neither too short or too long a period of time, but given the scale of the exercise, I think you are really quite determined in if you promise that the review can be completed in a year's time. But I hope that there can be discussions with us at various stages instead of just presenting the report to us at the end of the period. And there are things that we know without review that improvements should be made. For instance, manpower shortage. Can you tell us at once, in the coming 5-10 years, how many more new doctors and psychiatric nurses we can expect that will make us more assured? Because these are core factors to your services. So if you only take action after you have spent 1 year on the review, that means another year of delay. Sure, we will give progress reports at stages, and we can certainly report our progress to this panel in the interim. And I do agree that many of the problems are caused by manpower shortage. And the problem we face is even if we have the money to recruit new staff, there aren't any available. So we really have to review the demand and supply of healthcare personnel. And I think the review committee has to spend a lot of time discussing manpower. My point is you should not really spend time discussing that in the review committee. Why don't you start taking action to increase manpower supply? Mr. Albert Ho, I think the secretary, the deputations attending today are old friends because they have come to the council many times, and time is really pressing. And it appears that the administration cannot give us confidence in improving the situation. Still, since Dr. Ko is here personally, I hope that he can bring in a new start. And I hope that Dr. Ko has heard the deputations clearly. Some deputations said that given the current situation, while community-based rehabilitation is the right way forward, there aren't sufficient supporting facilities for them. For instance, there aren't suitable housing, and there is no one to follow up to ensure that discharged patients will go back for follow-up consultation and take medicine on a regular basis, and they only get 5 minutes each to see the doctor. There is no proper coaching on how medicine should be taken, and they suffer from side effects. They may be too tired, too drowsy to work, and there is no sufficient employment support. Given that situation, you ask patients to be discharged quickly and receive rehabilitation in the community. Is it really appropriate? And we don't want to keep patients in hospitals permanently. We're not as cruel as that. I think deputations are saying that community facilities are far from enough. From time to time, we have an incident in the community where there was violence and fatalities and death caused by the person concerned, and then he may have to be hospitalized for a long time, and that the shock created in society and the discrimination that follows can be quite considerable. So the DP would want an interdepartmental, interbureau working group. Of course, Dr. Ko should take the lead, but there are measures that should be taken at once to create immediate effect. Otherwise, more incidents may deepen discrimination and cause confidence to further be shattered. a short reply. We agree that there should be a review, and if there are things that can be done at once, we will not wait until the review is completed. And as a strategy, well, I agree with Mr. Albert Ho. We should focus on how we can provide all the necessary support to ensure that community-based rehabilitation can really work. I think this will be one of the emphases of our review. Thank you. Mr. Chen Hempan. He is at another meeting next door. Then Ms. Elizabeth Kwok. Thank you, Chairman. I'm quite concerned about the situation faced by ex-mental patients in the community. When I studied marriage and family counseling, I was attached to Ka Chong Hospital for a year for internship, and I really felt that psychiatrists would like to give more time to each patient. Unfortunately, there are too many patients, too few psychiatrists, so some of them felt rather depressed themselves because they face a lot of frustrations. So manpower shortage is a big problem. So while you have the good intention to ensure reintegration into society, well, that is good. I am also a district councillor, and I think these are really very difficult cases. I've seen cases where family members have to lock up the front door permanently because they have an ex-mental patient at home, and he may scream and yell from time to time, and family members don't want to frighten the neighbors. I know we have to protect the privacy of these patients, and you may not have enough manpower to ensure that a discharged patient take drugs, take medicine regularly, or go to follow-up consultations. We've seen cases where these people frequently hammered on the walls and the floor. Now we cannot force them to attend follow-up visits. We cannot ask them to be hospitalized. I think these are very common happenings in society, and I don't have any solution. While I know the Secretary is really committed, I am worried that we may have to wait for a long time, and how we're going to address the problems we have now. If patients are discharged prematurely when community facilities are not sufficient, is it the best approach? Because I was at a meeting next door, I was not able to hear the remarks of all the deputations, but I can refer to the minutes. Ensure that I will read the minutes. Do you need a reply from the Secretary? A short reply. Yes, I understand that Ms. Kwok had a first-hand experience in a psychiatric hospital. I agree that when community support is not sufficient, then a discharged patient cannot be assured to take his medicine regularly and to attend follow-up visits. Then it will be a frustration to our efforts and rehabilitation plan. Mr. Hempan. My apologies, Chairman. We've got a few meetings clashing together. As a representative of the DAB said, we had an exchange meeting with self-help groups. Many ex-mental patients or their family members are troubled by the need to attend follow-up visits. There is no evening outpatient clinic services, so a patient, an ex-patient, has to take leave to attend a consultation. He has to tell his company a medical certificate, and it will be clearly set out that he's attending a psychiatric outpatient clinic, and that may cause him to be stigmatized. So can there be evening outpatient services for the mental health patients? Not necessarily in all clinics, in all districts. In 2001, there were such services, but they were cut because of a low usage. But I think the number of mental patients have grown by 70,000 compared to what it was in 2001. So can the services be revived? Secretary, well, I deliberately refrained from mentioning that. I think we all know about the history of the service. I will see whether the doctors present, that is Dr. Whether Dr. Zhang and Dr. Tang would be interested to respond. Okay, Dr. Zhang. Thank you. I want to thank the deputations and members for your very valuable comments. We have heard them, and I'm sure such comments will be very useful to our provision of services. Well, there are a lot of things we'd like to do, but it all boils down to manpower. For evening outpatient clinic services, we need manpower. But providing that, we have to cut our service in the daytime. Well, as mentioned, during daytime consultation, each patient gets only 3 minutes. If we introduce evening services, that means even shorter consultation time.
So I would ask Dr. Dunn to talk about drugs. Well, perhaps we can defer the discussion of the drugs later on. You talk about manpower problems. I don't think it's logical. If a psychiatrist can handle 40 cases on the daytime, if you shift him to a night shift, then he can still handle 40 cases. I don't think it has to do with manpower problem. If you say that he can handle 40 cases during daytime, and then if he's to do a night shift, he can only 20 cases, and that would be a waste of resources. That's a reason that you gave for declining evening clinics in the past. Can you utilize the doctors better so that, say, 2 doctors can be on the night shift in the evening clinic, and make sorts of good arrangements? I don't think it has anything to do with the manpower resources. You are not wasting the manpower. It all boils down to your manpower planning. Ms. Alice Mack. There was this case announced yesterday. A patient from Kwai Chung Hospital, he hanged himself, and he was locked in this ward for over half an hour, and no one knew about it, and he hanged himself. Now, if we talk about psychiatric services, we have to cover education, treatment, and intervention and rehabilitation. If the environment of the hospital is so bad that they really dislike it, how can good rehabilitation services be provided to them? I have this patient, and he has lived in the hospital for 4 months, and he gets more and more depressed. He doesn't want to see anyone, and his condition fluctuates. And actually, a lot of the patients are sort of so-called professional patients, and they would put up that they have really recovered so that they can be discharged. But the doctor spends several minutes to see the patient every day, and then you will be cheated into the fact that they have well recovered and can be discharged. I mean, the doctor. So the family members of the dead told us that the doctor couldn't spend more than a few minutes to see the patient every day. So the LegCo had been requested to grant a funding of $48 million to maintain Kwai Chung Hospital. It seems that it would be spent on the hardware, like the tilings and all that. Could you do something to improve the environment of the hospital ward as a whole, so that it would not be that depressing to the patients? Now, for those discharged from the hospital, there is a problem of drug. But I want to talk about the follow-up visits. The administration put $1.9 billion over 5 years on mental health, taking 0.2% of the GDP, but whereas for other countries is 0.5 to 1%. I don't know whether the administration plans to devote more resources on mental health services. I understand that Dr. Ko said that old drugs might not necessarily be bad, but can we devote more resources to provide new drugs to patients? But apart from manpower, which I understand that takes time, I mean training manpower, can we do more on the other fronts, on the other software? Well, yes, I will be brief. On primary care clinics, what is the effect of adding psychiatrists at these clinics to handle mental patients? I would respond like this. Based on the needs, I would try to strive for more resources to be devoted to mental health services. Mr. Vincent Fang, I have to declare that I am a chairman of the Hospital Governing Committee of Kai-chung Hospital. And in the complaints division, in May, we have received a complaint, and all the problems boil down to the lack of resources. Well, this is nothing that we can do here. I think this is something that we should talk to the FS about. We have so much a big surplus every year, and he's been talking about money spent in a worthwhile way. I think all the services that we're talking about today need more resources. There is a lack of psychiatrists, nurses, and equipment, and the wards, hospital wards, are like prisons, so to speak. So if resources not added, how can the doctors spend more time with the patients? There is nothing the psychiatrists can do. And I understand that new drugs have less side effects than the old drugs, but without resources, what can you do? In fact, the Kai-chung Hospital has been saved up on other fronts so that they can spend more on new drugs. Several years ago, we launched this outreach programs, which are very good and are appreciated by a lot of patients. But if you don't have the resources, how can you expand your outreach services? So all in all, we have to talk to the FS to get more resources. Say, squeeze $500 million or $1,000 million from the budget, then that would go a long way in helping these patients. For the inadequacies in services, I think we have to sympathize with the medical staff at hospitals. They have been working very, very hard, but without the resources, there is nothing much they can do. And last week, the Kai-chung Hospital applied for funding of $48 million for repair and renovation. Dr. Ko knows about this very well. There was a they were originally on the list for funding, but then the project has been deferred till 2023. I don't know why. I think it's all a matter of resources. Yes, Dr. Ko? I just want to remind you that if time permits, please leave some time for our psychiatrists to talk about the drugs in hospitals. Dr. Dang. Yes, Mr. Chen Kim-po. Next. Thank you, Chairman. There are some 207 case managers dealing with 12,000 mental patients. One has to handle 57 cases. The services are supposed to be personalized. With such a high ratio, how can the services be personalized? Secondly, the paper also mentions the median waiting time for first appointment is 12 weeks. You have launched measures to reduce the waiting time. Now, after the new measures are implemented, how will the time be shortened? If the public has better understanding of mental patients, I think it will help much in the patient's rehabilitation, so that they can better integrate it back into the community. What is the government planning to do to enhance public education on mental patients? Okay, perhaps, yes, please answer Mr. Chen Kim-po's question first. On your last question, we would definitely covering public education in our review. Yes, I will speak briefly before I hand the time over to Dr. Dunn. On case managers, the ratio that we set now is 1 to 50, and there will be a review on whether this ratio is appropriate or not. It's already an improvement from what we had in the past. Of course, we are still short-handed. In the next 2 years, we hope to hire more case managers. Now over to Dr. Dan on drugs. Thank you very much for your concern on mental health services. On the use of drugs, a lot of people are concerned and asked for more new drugs to be used. Over the past few years, we have put more resources into using new drugs. Actually, patients have more choices now. But I want to say that new drugs are not necessarily better than the old drugs. Well, international experience tells us that new drugs do have their own side effects, and old drugs do have their pros and cons. And what is more important is that we provide more choices to the patients. And also on the clinical level, there should be more communication between the patients and family members and the medical staff, so that the best medicine can be prescribed to the patients. I am very happy that the HA has given us more resources to provide more drugs. There will never be a case where a patient needs a certain drug and then he has to pay for it. I think we have been very lenient in our prescription of drugs. Yes, Mr. Wu Chi-wai next. Thank you, Chairman. I have 2 questions. I want to understand case managers. What sort of training has a case manager gone through? Are they psychiatrists or psychiatric nurses? If they are adequately trained, I think case managers are a good program. Now, on the drugs, HA has a drug formulary. In the drug list of hospitals, well, that drug list is more comprehensive than the SOPC's drug list. Now, the doctor said that patients won't get poor treatment because he's not prescribed the appropriate drugs. Can I understand that if a patient has been discharged from a hospital and he is going to follow-up visits to the SOPC, but because the drug list of the follow-up of the SOPC is shorter than the hospital list, would his choice of drugs be limited in a way? Yes, I have to extend the meeting for some time. Well, first, on the on the case managers. They should have some clinical background. They should be OTs, nurses who have worked on mental patients, MSWs, and so on. We have provided them a special class before they can become case managers, and they should also undergo some practicum, and we will supervise them when they are on duty. Now, I would defer to Dr. Deng to talk about drugs. In hospitals, if a patient has been prescribed a certain type of drug, he will be given the same drug in the SOPC. Well, because all the hospitals are put in a cluster, so that they can visit the SOPCs within that same cluster. Sometimes they can actually be seeing the same doctor, and so there is a continuity in their treatment. Now, conversely, actually, some drugs, some drug companies have stopped producing old drugs, and some patients may not be continuously be prescribed old drugs. I want to clarify one point further. Is the drug list of the hospitals the same as the drug list in the SOPC? Because we've encountered cases before that patients treated or discharged by hospitals, when they visit the SOPCs, they're not prescribed the same drugs, but that drugs of a similar efficacy. That's what they are told. Well, they are the true drug lists are the same. Yes, Mr. Pun Xiaoping. Thank you, Chairman. The Secretary talked about the review, and we'll wait for the review in the results in a year's time. I'm happy to hear the views from the Civil Services Association. He talked about the MSW has to handle a lot of other trivial and clerical duties, which should be handled by the social work assistants. So I have this question for him. That is going to affect the service and also their workload. Can the government really do something immediate to rectify the problems he mentioned? Secretary?
May I invite Mr. Lam? Now, if this is about social workers, then I invite Mr. Lam Ka-tai to respond. Mr. Lam. Speaker is off mic. Speaker is off mic. In the past few years, we have increased 69 medical psychiatric MSWs. In 2006-07, there were 174 psychiatric MSWs. As at end December last year, we increased to 243 on average. The number of cases they have to handle has decreased from 91 in 2006-07 to 62 as at end December last year. Some medical or some MSWs may feel that they have to deal with applications for waiver of treatment fees. We have very good cooperation with the HA. We've arranged for administrative assistance to assist MSWs to handle such applications, hoping to lower their workload. And a patient may just show his waiver card, and is also applicable in different hospitals and clinics. The card is valid for 1 year. So in the past few years, we have seen a reduction in the number of such applications. Thank you. You have a follow-up, Mr. Poon? Well, but that's a very real complaint from the MSWs. A short reply, please. All right, I'll be very quick. Well, dealing 91 cases, a drop from 91 to 62. Now you are talking about at any one time, but for the whole year, taking the whole year, each MSW has to deal with over 200 cases, and we spend most of the time in applying or waiting for places in halfway house, sheltered workshops, and so forth. We're asking for 2 social welfare assistants to do that. Instead, we can give you 1 MSW in return 2 assistants. Well, this is not about the distribution of work, but the nature of work, because some assistants can carry out tangible works. Well, this afternoon, members are concerned about problems in the community. I'm more concerned about schools. The organization I serve has a school project admitting SEN or students with special education needs. Some of them have psychosis. According to the school, there are about 60 cases, or there are only 16 hours allocated to school. In the school I serve, there was a student who almost jumped from height. So we're providing 300 hours of clinical psychologist services. So services in this regard is really inadequate. So I hope that the review will cover the needs in secondary schools as well. Dr. Ko, I will we will include this in our review. Thank you. Ms. Helena Wong, thank you, Chairman. We really support the Secretary in his intention to increase resources, to improve manpower, and to use drugs with fewer side effects. In a LegCo sitting, I asked a question about sexual abuse cases in psychiatric wards. And then I found out that the reporting mechanism was one of a voluntary basis, and there were only 13 cases reported a year. So I think there's been severe underreporting. Since the Secretary agreed with me that sexual abuse is a serious criminal offense, how come it is for the medical health, the healthcare personnel to decide whether cases should be reported or not? We asked for a breakdown of cases in different hospitals, and there is no single case from the Taipo Hospital, whereas there were complaints from nurses there that there were few cases happening in the hospital last year. So will the Secretary review the notification mechanism as well? Because the patients subject to sexual assault or abuse were in straitjackets, so they were not able to protect themselves. So for those in straitjackets, can you have additional protective measures other than just the normal security measures? Dr. Zhang. Well, indeed, these are criminal cases, and we always report to the police. But if it's just an attempt, it hasn't really happened, then it may not be reported. All right, thank you very much, deputations and individuals, for coming here to express your views. All your views will be recorded for follow-up, and the next item is to discuss whether a working group will be set up to deal with policies of mental health. You may choose to stay or go as you like. Dr. KWOK Ka-ki suggests that a special or subcommittee be set up under the Health Services Panel. Or rather, it should be a joint subcommittee with the Welfare Services Panel. And the terms of reference, the work plan, and also the program have been circulated to members earlier. the Welfare Service Panel will have to meet later to discuss this issue. We are now consulting panel members here. Do we support Dr. KWOK Ka-ki's proposal? Dr. KWOK, is there any need for you to supplement? Thank you, Chairman. Well, we have met the deputations today, and then the administration is setting up a review committee, and it plans to complete its work within a year, and I hope we can interface with the administration in this regard. Mr. Wong, well, we already have this panel. I think that is enough to discuss with the administration. And then we already have a queue for subcommittees. I think by the time it's our turn, the government's report may already be published. I really don't want to set up subcommittees too lightly because we're all so busy. Meetings clash with one another. You know, next door the Welfare Services Panel is going on. We have to rush from one meeting to another. I just cannot cope. Fingers, yes, of course. Our mental health is very important, but I don't think we can only show our concern by setting up a subcommittee. Any other views, please? Mr. Vincent Fang? I tend to agree with Mr. Wong Ting Kwong. I think both psychiatrists and nurses have done their level best. All personnel have done their level best. The bottleneck is resources. If we don't have more resources from the government, then no matter how many more subcommittees we have is useless. So I think we should focus our efforts on lobbying the FS to provide more resources. Mr. Chan Kim-po, I think this panel can deal with the issues just discussed. Oh, okay, then. So we don't have too many members present, and it appears that there is no majority support for setting up the subcommittee. Perhaps if Dr. KWOK would like to follow up on this proposal, let's do so at another meeting. Yes, not all members are present, so I request that we discuss this again at the next meeting when we have more members present. Mr. Wong Ting Kwong, Chairman. Do we have a quorum, Chairman? We do. Since we already have a quorum, why can't we make a decision? Some members like to say that it is members' responsibilities to attend meetings. Now, if they are absent, what is the justification for us to wait for them? Well, even if we make a decision today, I think members have the right to rehearse or to revive the decision. Well, if he disagrees with the decision this afternoon, he can ask. You can seek to overturn our decision today. I've sat here for so long. I have heard all the deputations. Why have I chosen to stay behind? Because it is my responsibility. Or it doesn't matter. Anyway, as I said, I do not see any majority support for this proposal here. So, the proposal is vetoed. Chairman, dare you say that the position is vetoed? I think Dr. KWOK Ka-ki has not asked for a motion, has not moved a motion. All right. You are also leaving? All right, I think it's up to Dr. KWOK to decide how to deal with it. All right, so The meeting adjourned. Thank you. Thank you very much.